Welcome to a set of highlights from a recent webinar sponsored by the International Cardio-Oncology Society. I'm Dr. Tom Murtaugh of the Christ Hospital in Cincinnati, Ohio, on behalf of ICOS. It is already time to start planning your trip to the Global Cardio-Oncology Summit, which will be held in Cape Town, South Africa, on October 30th to November 1st, 2025, at the Century City Conference Center in Cape Town, South Africa. The conference starts with a day devoted to research and basic science, followed by 2 days of general sessions. You can find information by going to the ICOS website at ic-os.org and then look under the Events tab where you'll find all the information. We hope to see you there come October 2025. Today's highlights come from a recent webinar on the importance of exercise training in breast cancer patients, even well after the completion of therapy. Our main presenter is Sara Hassing Johansen, who is a researcher in the Department of Physical Performance at the Norwegian School of Sports Science. Also involved in the presentation is Dr. Tormod Nielsen, who is an associate professor at the same institution. So please enjoy these highlights from their excellent webinar.
And first off, I want to give you some short background for the trial because the results I'm going to present today is from the CAUSE trial. And as many as you know, breast cancer is the most common cancer diagnosis in women. And the treatment often includes chemotherapy, radiation, and this endocrine therapy. So this cohort of patients is at the risk of several late effects because of the tough course of treatment. And here you can see a list of the most common late effects following breast cancer treatment, including this increased risk of cardiovascular disease, early mortality, changes in body composition, reduced cardiorespiratory fitness, reduced quality of life, and fatigue. And we also know that cancer therapy has this indirect effect on the body, including reduced activity level and changes in body composition, which also have a negative impact on the body. And from now on, I'm going to focus on this cardiorespiratory fitness. And in addition to be this gold standard marker for physical capacity, cardiorespiratory fitness is also an independent predictor of numerous chronic diseases. And therefore, it's worrying to see that cancer treatment may lead to reduced cardiorespiratory fitness. And recently, we published a meta-analysis aiming to evaluate the effect of systemic cancer treatment on cardiorespiratory fitness. And our results showed that systemic treatment was associated with a significant decrease in VO2 peak by around 9%. And we also found that VO2 peak remained up to 20% lower in cancer survivors many years following treatment compared to these non-cancer controls. So as you can see demonstrated in the graph, we can see that VO2 peak drops during treatment and remains low. And compared to normal aging, where VO2 peak reduces by around 1% a year. And this drop in VO2 peak during treatment is equivalent to around 10 years of aging. But on the other side, we have this trial showing that exercise can prevent a decline in cardiorespiratory fitness during and shortly after treatment for breast cancer. And for example, we have these big and very good trials like the OptiTrain trial and the Brexit trial. But today, few trials exist on long-term survivors. And when I'm saying long-term survivors, I'm meaning survivors more than 5 years following treatment. And also a paper by Scott and colleagues from 2020, which evaluated the effect of exercise in breast cancer survivors 3 years post-treatment. They suggested a reduced exercise response among these breast cancer survivors. And also, in light of all the common late effects that you saw on the earlier slide among these breast cancer survivors, we have limited research on the effects of exercise on these late effects. For example, fatigue, pain, and quality of life. So that was a short background for why we designed the CAUSE trial. And the CAUSE trial is a big randomized controlled trial completed at the Norwegian School of Sports Sciences together with Oslo University Hospital. And the primary aim of the CAUSE trial was to evaluate the effect of aerobic exercise on cardiorespiratory fitness and other cardiovascular risk factors among these long-term breast cancer survivors. And we also wanted to compare the exercise responses in these long-term breast cancer survivors to non-cancer controls. Short background for why we designed the CAUSE trial. And the CAUSE trial is a big randomized controlled trial completed at the Norwegian School of Sports Sciences together with Oslo University Hospital. And the primary aim of the CAUSE trial was to evaluate the effect of aerobic exercise on cardiorespiratory fitness and other cardiovascular risk factors among these long-term breast cancer survivors. And we also wanted to compare the exercise responses in these long-term breast cancer survivors to non-cancer controls. So in the CAUSE trial, we identified and invited breast cancer survivors through the Cancer Registry of Norway. And some of the inclusion criteria were adjuvant treatment with epirubicin, that they got their breast cancer diagnosis between 2008 and 2012. They exercised less than 90 minutes per week, and they did not have any cardiac diseases. And in addition to these breast cancer survivors, we also include 69 females for the non-cancer control group. And these were females with no cancer history. And they were also supported to have the same age span and activity level as the breast cancer cohort. And these non-cancer controls were recruited through the media. And on this slide, you can see the study outline. So the breast cancer survivors were diagnosed in 2008 to 2012, and we started the inclusion in 2020. So the T0 is the baseline testing. So all the included breast cancer survivors underwent a lot of different tests at baseline before they got randomized into two groups, one exercise group and one usual care group. The exercise group underwent aerobic exercise on treadmill, 3 sessions a week for 5 months. And every session was supervised, so it was a long intervention period. And the participants in the usual care group were only going to continue living their normal life before both groups went back and did the same tests at T1. And for all the breast cancer survivors, we also collected questionnaires at 1 year follow-up. Similar in all 3 groups. So all groups had VO2 peak around 90% of predicted values, and that's quite good. But following these 5 months of aerobic exercise, we can see that the exercise group increased 1.2 milliliters. And the usual care group, they remained stable. But then we have the non-cancer controls. And we remember that the non-cancer controls did exactly the same exercise intervention as the breast cancer survivors. And after these 5 months of exercise, they increased their VO2 peak with 2.6 milliliters. So the mean difference in change between the non-cancer controls and the breast cancer exercise group was 1.4 milliliters, and that's a big difference. And here you can also see two waterfall plots for the change in VO2 peak for the true exercise group. And here we can see that 52% of the breast cancer survivors increased their VO2 peak more than 1 milliliter, compared to 75% of the non-cancer controls. And 16% of the breast cancer survivors increased their VO2 peak more than 3.5 milliliters compared to the non-cancer controls. But overall, as you saw on the cardiovascular risk factors, our cohort was quite healthy. They had a good function, and they reported on average good fatigue scores. So therefore, we did some subgroup analysis to see if the effect of the intervention was different in those participants reporting having, for example, fatigue at baseline. And after digging a bit deeper into our results, we found that 20% of our cohort reporting having chronic fatigue at baseline. So on this graph, you can see the participants within the exercise group reporting having chronic fatigue at baseline compared to those participants in the exercise group not having chronic fatigue at baseline. And here we found that it was the breast cancer survivors who had chronic fatigue at baseline that experienced the highest benefits of exercise, with a reduced fatigue score of 7 points compared to 2 points among those without chronic fatigue. And this is a very important finding, as we know that fatigue is one of the most common late effects in these breast cancer survivors, and also that fatigue is one of the strongest predictors for reduced quality of life in this patient group. And we also saw this trend for the other variables as well. So here you can see an overview of all the variables from the questionnaires, where the green mark indicates a significant difference in the effect of the exercise among the breast cancer survivors reporting having late effects at baseline compared to those without. So, for example, the exercise intervention was most beneficial for the participants with poor body image compared to those with good body image, and most beneficial for the participants with reduced physical function compared to those with the highest physical function, and so on. The same trend for the other variables as well. And that was the main results from our trial. But of course, we have both strength and limitations, which is important to mention. And some of the strength is that the CAUSE trial is one of the first randomized controlled trials to compare this difference in exercise response between these long-term survivors and non-cancer controls. And it's a high-quality trial where we have a large sample size. We had this long intervention period, and we also had supervised training and gold standard testing. We had good adherence to the intervention, although it was during the COVID-19. And we also recruited participants through the Cancer Registry of Norway, which ensured that all qualified breast cancer survivors were invited. And some of the limitations are, because of the limited research available when this trial was designed, our sample size calculation was based on results from a different cancer diagnosis cohort. And our high baseline VO2 peak may also reflect some selection bias. But on the other side, we see that our values are similar to other Norwegian and Swedish breast cancer cohorts that have received the same treatment with epirubicin. And we also had some loss to follow-up, especially on the 1-year follow-up. And it's also important to remember that our trial was designed to improve cardiorespiratory fitness and not all the other related effects from the questionnaires. So maybe other types of exercise, for example, strength training, would be more beneficial for many of the other laid effects. So then we have the conclusion. Aerobic exercise is well tolerated and significantly improves cardiorespiratory fitness among these long-term breast cancer survivors more than a decade after treatment. But the exercise response in terms of cardiorespiratory fitness was blunted compared to these non-cancer controls, which may indicate a persistent treatment-related toxicity affecting the cardiopulmonary muscle axis among the breast cancer survivors. But we also saw that aerobic exercise improved fatigue, body image, and quality of life compared to usual care, with the most pronounced benefits observed among those with the highest baseline symptom burden. And at 1 year follow-up, most of the values returned towards baseline values. And what are the implications of our finding? And today, due to the improvement in treatment, we have this growing population of cancer survivors, and not only here in Norway, but also worldwide. And that means we need effective intervention to maintain good health during the survivorship. And we have a lot of research that exercise is an effective intervention, and our results also confirm this by showing all the positive effects of the exercise among these long-term survivors. But the blunted response reflects a long-term consequence of treatment. And also our results highlight the importance of research in these long-term survivors. And we also need more research, for example, on the underlying mechanisms for the differences in exercise response. And that was my presentation, so I have to say thank you for your attention.
That was an excellent set of highlights from an equally enlightening webinar. If you enjoyed that, you might want to check out the entire webinar, available on the ICOS website, which contains an interesting discussion at the end. Don't forget to visit the ICOS website and become a member if you are not already one. While there, look at some of the information regarding the GCOS Summit in Cape Town, South Africa, and consider attending this excellent event. Until our next webinar highlights, ICOS reminds you to treat cancer, protect hearts.